So as we wrap, because we're just getting really close to wrap up here, is there any other um, story that you want to leave with, like a patient account situation that you want to leave us with that as the listeners
Yes.
or those are watching, right, can feel a bit more connected to that story and maybe some hope?
Yes. You reminded me of this earlier in our podcast. We had a client who came in, a woman in her middle age, mid 50s, late 50s, and very tall, lovely lady. And she was in the examination room when I walked in, and she came in, and I said, "Okay, well, we're going to get started after we talked a bit," because she was standing. She was standing. Usually clients will sit, and then I will sit across from. I'm not going to sit down. I can't sit down. I said, "Okay, so we can stand." I did her history. "Okay, well, let's sit on the table." "No, no, no, I can't lay down. I can't sit down." She was so afraid of movement, and she was stiff, her neck like this. And when she showed me her neck, it looked like so red and blotchy because she was using so much heat on her neck. Her skin was
Mm,
getting damaged, like
mhm.
almost burnt, right? Because our skin thins as we get age, and then you're using this heat all the time. The only thing, because her neck was as stiff as a concrete column, and she would not move. She would turn barely. If someone was watching, they could see me mimicking this a bit. And she was so afraid of everything. And this woman she's a nurse in her background, nursing background, and she was also an aerobics instructor for 20 years.
So
So
someone
this is when
who
aerobics.
loved movement for most of her life.
Oh, yeah. And
Yeah.
she was leading that in the time when aerobics was really big, right? The Reebok era and all these things. So it was really desperate for her. And we were able to evaluate her and standing up and over time get her into, as we started to improve her condition with different types of a suite of therapies for the vestibular and for the cervical spine and metabolic and things of this nature, visual, ocular training. We were able to get her to lay down in a
Yeah.
lot of fear,
Yeah.
start to recalibrate her vestibular system. And well, the current model is she travels now back in the car with her husband, driving all over the United States. They can drive from where we are, South Florida, all the way up into the mountains and, Southern America and the mountains in Colorado, even out west. And so it's completely different. She works out in the gym. She's back to doing the things that she loves to do and wants to do with her husband and her adult sons and just enjoy life without these limitations.
Yeah.
And that's the story of functional neurology, helping someone with a chronic, severe vestibular issue that
Mm,
had gone unchecked and
mhm,
uncorrected for years,
mm.
other than take your meclizine. That's all we have for you.
Right, right. Well, I know that lovely lady, so if you're listening, we care for you. But thank you for that story because it is such a remarkable reminder, especially if we've known her for quite some time now, and, all her everyday things that she's doing now could be kind of like, "Oh, well, that's just normal."